welcome to another Wellness Wednesday. I'm Christine.
My name is Lana.
So, today for our Wellness Wednesday, we are here to talk to you guys about a little bit of a sensitive topic that does not get a lot of attention. And this topic is inviting medication alongside counseling, specifically antidepressants.
So, just as a disclaimer, we are not medical professionals. We are just peer educators, and we are here to present to you guys the facts and evidence that we have gathered. At the end of the day, everyone's mental health journey is different and special, and ultimately is your own journey. You know yourself better than we do, so take our advice at your discretion. If you need additional support or need other additional advice, don't be afraid to take other advice or seek out other medical professionals and therapists, as well as utilize our own resources here at the UCC. So, without further ado, let's continue on with our Wellness Wednesday. There are two different types of antidepressants that we're going to really talk about, and we're also going to talk about the design of it and what its purpose is. So the two types that we're going to be talking about are SSRIs, short for selective serotonin reuptake inhibitors, and SNRIs, short for serotonin norepinephrine reuptake inhibitors. These are very, very long words, but the main difference between the two is just the way that they interact with the chemistry of the brain. In my personal experience, I see a lot of SSRIs distributed more than SNRIs, since I myself was put on a couple of SSRIs and have never even touched an SNRI.
So, SSRIs are often considered first-line treatments for depression and anxiety due to their general preferences for their side effect profile. So, SNRIs are preferred where SSRIs are not considered effective or can't treat certain pain syndromes that can go alongside depression and anxiety. With that thought, maybe that's why you haven't encountered an SNRI, Lana, considering how much more common SSRIs are than SNRIs. Because both medications interact with the brain, it is important to remember that side effects may occur, or it may not. It entirely depends on the person and how their own brain takes it. Everyone is unique, so we can't exactly guarantee which medications will have side effects or not. So,
With that being said, I just put up a list of SSRIs and SNRIs. So take a quick look at this list, see which one is more familiar to you, which category. But yeah, I personally think that the left one, SSRIs, are much more common rather than SNRIs. I'm not really familiar with the column on the right. With every prescription drug, we all know that we can't buy certain prescription drugs over the counter at your local CVS or your Walgreens. A lot of the medications that we did show require a prescription from your psychiatrist or your own personal doctor. If you are receiving counseling, keep in mind that your therapist cannot be the one to prescribe you with anything. Therapists can only really refer you to psychiatrists if you are interested in receiving medication. There is another option to just go to a psychiatrist without therapy, but regardless, they will still conduct some kind of evaluation. When I first began welcoming medication into my life, my therapist provided me a recommendation to receive a prescription, so they referred me to the student health center. When I showed up to the student health center, it wasn't my therapist doing the evaluation and handing me the medication. It was another medical professional, totally different altogether, conducting that evaluation.
So now we're going to jump into the design and purpose of counseling itself. So it is important to note that there are various types of therapy available for a person to partake in. Although there are many types of therapy available, for the sake of this Wellness Wednesday topic, we will highlight two therapy types. The first one is cognitive behavioral therapy, also known as CBT, and psychotherapy. So cognitive behavioral therapy, CBT, is helpful to explore and change how you think about one's life and patterns of behavior. It has been shown that CBT has been effective in helping people who are experiencing depression, anxiety, panic disorders, phobias, OCD, and PTSD. Here are just example questions that are typically asked in a CBT. So the first one is, what is one goal you would like to work towards? The second one is what warning signs might indicate you're going back into your old patterns. And the third one is what would you do if you notice these signs?
So the different or another type of counseling that we're going to be talking about is psychotherapy. So psychotherapy is an approach that consists of helping with mental health issues by talking with a psychologist, psychiatrist, or another mental health therapist or worker. During psychotherapy, it entails talking about one's specific struggles and how thoughts, emotions, and behaviors affect one's mood. Similarly, this helps people dealing with anxiety disorder, mood disorder, addictions, eating disorders, personality disorders, and schizophrenia. Some example questions that are typically asked in a psychotherapy session is, how did that experience make you feel? And what goes through your mind when you think about that situation? So what people think the stereotypes associated with counseling or therapy, with someone laying down and the therapist is like, so how does that make you feel, right? So the purpose of both CBT and psychotherapy is that they are both grounded in the understanding that an individual's thoughts, feelings, and behaviors are all interconnected, and that changing negative and positive thoughts or behaviors can lead to a change in one's own feelings or emotions. Moreover, they provide tools and strategies for individuals to deal with their issues adaptively and can ultimately help lead to improved mental and physical well-being. With our third and final section, which is combining both inviting medication and counseling. Personally, I know a lot of people that have received either or, only receiving counseling or only receiving medication or taking medication. For many people, this works for their own personal mental health journey, and I myself have only done one or the other.
Yeah, I can be in the same boat with I know people who've only received counseling or one or the other. But for me personally, I don't have much experience with counseling, but I do have a bit experience taking medication in a general sense when it is for pain, when I have surgeries. So, however, I do find a conversation of inviting medication and counseling an interesting topic to dive into, especially since I know there is some stigma in that domain. So, here's a quote that actually supports this from Counseling Today. It talks about how patients with major depression and had low activity in a specific region of the brain responded well to cognitive behavioral therapy and poorly to Lexapro. Those patients with high activity in the same region did better with medication and poorly with therapy. While some individuals may respond better to one or the other, one question is still left unanswered. How effective would it be if we were to combine both of these? If it is just as effective to only participate in one or the other, why should we look at combining both?
So one way to actually look at this is by thinking about both in terms of the goals or what the purpose and the design is for each. So when thinking about medication, we want to associate medication with it being meant to aid with managing symptoms. For example, if I have a headache, I will take Tylenol to suppress the feelings of pain from my head, right? And for counseling, we associate that with establishing coping mechanisms, setting healthy boundaries, and uncovering underlying issues. So going back to that headache example, if I were having such a lot of pain in my head to the point where I'm so frustrated that I just bang my head against the wall because I'm just so angry and so irritated by the fact that it's that it's still going on, I will go seek a therapist, and that therapist will say something like, hey, that's not really something healthy. That's not a very healthy behavior for you to be practicing. Here are some different ways for you to manage that frustration instead of banging your head against the wall. So combining both of these. So I will be taking the medication to suppress those feelings of pain from in my head, and my counselor will be helping me walk through, okay, in the event that you continue to feel this pain, here are some things that you can do instead of, banging your head against a wall. Go take a walk, maybe go read a book, maybe just distract yourself, go outside, do something else, get your mind off of it. So it's kind of just both helping each other out in ways that the other isn't really reaching, if that makes sense. So to kind of put it in a different or another kind of like words, while medication helps with the actual physiological part of mental health, counseling can help us practically in our everyday lives by giving us skills and coping mechanisms to utilize. Here is another supporting quote talking about both, also from the same source, Counseling Today. Researchers have also concluded that patients who are depressed and have a history of childhood trauma do better with combined therapy and medication than with either treatment alone. So, in conclusion, medication and counseling are both very, very intricate. If you or someone you know is only receiving one or the other, that is okay. Each person's experience is different and unique. What may work for you may not work for your friend or another stranger entirely. Welcoming medication alongside counseling is just another option aside from only seeking therapy, only receiving medication, or not seeking out either at all.
So if you ever need any type of support while here at APU, the University Counseling Center is always here for you. So we are located in the Shire Mods, right across the Student Health Center, and we offer free counseling with licensed clinicians for all undergraduate students. You can learn more about us by visiting in person, or you can book an appointment anytime. However, if it is an emergency, please call us at 626-815-2109. Although this was a very difficult topic to address, we hope it has been informative and beneficial to learn more about it for you or for someone else you might know. With that, thank you for listening to our Wellness Wednesday this week. Hope you have a good rest of your week. Bye.